Okay, everybody. Thank you for showing up today. I'm Dr. Richard Kim, and this is my practice, Richard Kim Medicine. And today we're going to be talking about how stem cells exactly solve pain. So without further ado, let's get into it. Let's start off with a couple of question and answers that we like to catalog from people throughout the month, and then put together some Q&A format. Lori S. asked from area code 315, how does stem cell regeneration work? And then Asa S. from 315 also asked what it is, process, how it works, and the efficacy. So really what we're planning on today is discussing what exactly regenerative medicine is, but we're also going to discuss who regenerative medicine helps. And so you can help understand whether this is the right therapy for you. Patricia then asked, well, from area code 585, well, I have a problem with lower back and sciatica. Yes, so these are the sorts of questions that we like to answer. These are the things that we commonly treat. What we really are is an alternative solution. We are a non-surgical solution and non-medication based, which is also important. When we talk about, when we meet our patients, we're often talking about goals and what our common goals are. And the goals that we usually have together are very much the same thing across all the patient categories. Number one, we want to avoid surgery. And number two, if we're on medications, we want to stop medications, or we don't want to start medications, we're trying to avoid them. And then lastly, of course, overall, what we're looking for is a quality of life, because we feel that the back pain has somehow negatively impacted our quality of life, and we'd like that back. How we get there, though, we want to ensure a couple of things. Number one, we, as both physicians and as patients, all want a plan. And as that plan is created, we want it to be safe. We want very low risk, but we also want something with very short recovery time. And of course, we want to avoid any pitfalls. We want to avoid any unnecessary dangers as part of that plan. Let's talk about a couple examples. The first one is our retired psychologist who flies airplanes for a hobby, is a runner, is competitive, and also does it to release stress. Back pain ultimately ended the running, and now there's no more competition or fun, and unfortunately the stress relief has gone as well. This led to limiting flying time, and so sort of an unfortunate couple of losses there because of back pain. The next is a chef who really enjoys spending time with his family, but as chef work goes, it's constant motion. You're moving heavy restaurant equipment, and the back pain was starting to affect his work, and that made the work day difficult, ultimately leading the patient here to contemplating changing careers. But overall, the people who were, these patients who were seeing other clinicians and they were missing the target. The reason for that is that traditional treatments have limits. Number one, surgery is often permanent, it's invasive, requires a very long recovery. And so for a lot of reasons, people are looking to avoid that. Number two, medications. Steroids are often a Band-Aid. They're very temporary. The downside of steroids is that they weaken and they damage tissue, which means that if you repeat steroids, you're causing repeat weakening and repeat damage to those areas, a very unwanted side effect. The next is over-the-counter medications. That's what OTC stands for. This often helps lessen symptoms, but the effects wear off, and that means you have to repeat the dose, and so it can be a hassle or an annoyance. So 2 months after stem cell therapy, we had our psychologist back to running, ran the 4th of July race here in town. It was a 4-mile race. Ran a 13-minute pace and was okay with that. Wished he could run it faster, but of course that comes with training. But it did give him the confidence to train for a half marathon with his grandson, and he was pretty happy to be able to complete that. The chef ultimately went back to work full time, able to provide for his family. So just a couple of perspectives of what regenerative medicine can do. When we think about pain, pain ultimately leads to degeneration. And when you develop degeneration, it then, of course, leads to more pain. Our job is to break that cycle. We are the third solution. So after surgery, after medications, what else can you really do? It's us. It's regenerative medicine. It's the third solution. Why we particularly favor regenerative medicine is that it comes with a high success rate, but it also comes with a result that lasts in years of relief, which is, of course, a very attractive feature, whereas with the steroids and medications, maybe months, maybe weeks. And there's this guaranteed acceptance with stem cells or with regenerative medicine, because the products come from you and then back into you, so there's no rejection ability. It is very much a steady and progressive benefit. So week after week, it's very linear in its improvement, as you can see here. So what exactly is regenerative medicine? It's a new field of medicine. Its primary goal is to restore and not replace tissues. We want to take damaged tissue and convert them into healthy, functional type tissues. We're looking for different materials to restore this health, including predominantly platelet-rich plasma and stem cells. If you can see the different circles there, the interconnecting circles, this is how we decide what's PRP and what's stem cell worthy. The small green and yellow circle are sort of small and medium-sized problems. And then, of course, yellow and red going into medium and then large. So PRP is great for the earlier type and smaller type problems, but stem cells, when severity, when the issue, when the area interest then becomes larger. This is a good video example of when stem cells are attacking an area. So red is bad here, green is good. The red is where we see pain, where we see stiffness and sciatica arising from. So being able to input these green healthy cells into the area and help eliminate that pain. My other favorite analogy is the Pac-Man problem and solution. If you could think about the pellets on the screen as inflammation, Pac-Man eats the pellets one at a time. Of course, many Pac-Man eating many pellets at the same time is more like stem cells, and one pellet at a time is maybe more like platelet-rich plasma. The goal here is to really beat and to leave the game. It's not to come back and play the next level and go through inflammation all over again. It's to beat and leave the problem altogether. How long does that exactly last? In our office, through our experiencing, we're seeing results that have lasted anywhere from 5 to 10 years. Where exactly do the stem cells come from? So if you can sort of see on the left side, the spinning pelvis, the back side of the pelvis is the source of extraction. And then, of course, we're injecting into key areas. For example, on the right-hand side of the screen, areas like areas of degenerative disc and so on. This is a basic timeline and schedule of when we do our process. And then again, this is not the same as everybody else's, but this is ours. And this is what we've developed over the last decade and 10 years and found successful. So initially, we always like to start off with the consultation, meet you, understand your problem. Pretty soon thereafter, we like to get an MRI. The first PRP happens after that point, and that is the beginning of our treatment course. The second injection is a PRP again, but this one includes the stem cell process. And then lastly, we're doing a third PRP, which then allows us to start the physical therapy, the chiropractic care, the exercise, and so on. What sort of problems can we address? What sort of things can we treat? Stenosis is big, arthritis, degenerative disc disease, sciatica. These are very much the common words or complaints leading to these sort of diagnoses when people come to us. Lower body-wise, we're talking again about more arthritis, bursitis, meniscus tears, and damage, Achilles tendon issues. In the upper body, rotator cuff, arthritis, tennis elbow, carpal tunnel. Everybody wants to know, are they a candidate? You're listening to me now and you're starting to wonder, well, yes, but is this for me? The way we really approach stem cell therapy is that anywhere that can be injected or operated on is able to receive stem cell therapy. So if you've ever heard of an area being injected or being operated on, we can put stem cells in the exact same area. For us, it's always important to start off with that diagnosis. An accurate diagnosis really leads to an accurate location. And now, of course, if you have an accurate location, then you've got a place to put, you have a location for your accurate therapy. All of our therapies include an MRI, and that helps us really understand which of these locations correspond to your diagnosis. What if you've had surgery? And the answer is yes. For us, it's important to start off with that consultation so that we can understand what sort of diagnosis that you're facing and what sort of diagnosis you've had in the past, even prior to surgery. The imaging is going to be important, where exactly you feel the pain is arising from, what's damaged, what's been operated on before. We like to understand the history of the examination and, of course, the type of surgery, whether it was an arthroscopy, a fusion, a rotator cuff surgery. Some frequently asked questions. Number one, where will my stem cells come from? You saw in one of the early slides that they come from the pelvis in some occasions. They can also come from your fat. How long before I can become active? So about the time that we do the third injection and start the physical therapy and the chiropractic care is when you can really resume activity. When do you feel the benefits? Benefits, again, vary for a lot of people, but between that second and third injection is when the majority of our patients start to feel the benefits. And then, of course, like the very early slide, just gets better week after week. How long will the tissue stay repaired? So different areas have different levels of success, but based on what we're treating, anywhere from 5 to 10 years. And then, of course, how well does this work? So in the majority of our patients, we are seeing some significant amounts of pain reduction and improvement. But again, everybody's a little bit different. Whether or not you've had surgery matters. What your activity and functional level is matters. So these are all things that we like to learn about you and be able to understand for you through our consultation process. So getting to some questions and answers, Therese asked from area code 438, what kind of therapy do you offer for herniated discs and what are the prices? So for herniated disc and degenerative disc disease, this is our favorite analogy. It's like a jelly donut. When jelly leaves the donut quickly or fast, that's like a herniated disc, and that just means that the jelly has shot out the donut. For those who have degenerative disc disease, it is like this constant slow leak of jelly out of the donut. Through stem cell therapy, it is essentially helping keep the jelly in the donut. And of course, if you've got a jelly inside the donut, it allows for compression. It allows for more mobility through that area of the spine, versus doing something like surgery, where you are just welding two bones into place, for example, in the fusion, and then preventing further sort of squish of the donut, if you will. Our therapy is different, again, in that our risks are minimal. There is increased recovery time with the more you cut. because more muscles, more tendons have to be cut and moved aside. And so that always makes the recovery process for surgery much longer. For us, everything is done through a needle, and so recovery is rather quick. Success is quite individual, but I can say, thankfully, that our results so far are excellent. And when it comes to cost of these procedures, it's impossible to say without having met you, Therese. And so certainly we encouraged a consultation to help us understand you and then give you a better accurate assessment of the whole process and all its logistics. Claudio M. from area code 862 said, what do stem cells do for osteoarthritis? Does it help the neck if you have mild to moderate bulging discs that are arthritic with possible nerve pinching? So again, jelly donut idea, but stem cell ultimately changes how osteoarthritis interacts with the body. So you will continue to have osteoarthritis, but simply not have the pain. In this scenario, we often like to describe that we treat patients and not pictures. So even though your MRI, even though your X-ray, even though your CT scan may show some signs of degeneration, ultimately, if you aren't feeling that degeneration, how much do you care what the X-ray looks like? And most people's answer is not a whole lot. And keep in mind, this is an effect that lasts years. And ultimately, once we get through, let's just say 8 years of being, pain-free, the whole process is repeatable. So you can gain another 8 years and then hopefully avoid surgery forever. Justin H. from area code 514 said, solutions for herniated disc in his low back. Again, we talked a lot about herniations, degenerative disc disease, and how the jelly donut analogy works for that. It's important for us to know what you have tried, Justin. Have you tried the physical therapy? Have you tried injections? But certainly if you're at the point of needing intervention, meaning that you're thinking about either injections or surgery or simply just looking for alternatives, we are the minimally invasive option. So it is a very real solution. Chuck H. from area code 518 said, I've had 5 back surgeries, 2 fusions, 3 decompressions, still have pain. Surgeries were a while ago, plus my knee replacement on November 23rd was terrible. More pain now than before. Can he help? So 2 different questions there. So with regards to the back surgeries, after fusion, decompression, you can still benefit. It changes your anatomy, certainly, by putting in these sorts of rods and screws into somebody's back. So it isn't exactly the same, but at its same anatomy as somebody who's never had surgery, but certainly important for us. One of the things that we think about here is something called adjacent segmental disease risk. So once you have a fusion in those 2 levels, as you can see on the right-hand picture there, the disc above and the disc below that are the adjacent segments. And then they have to bend and flex more in order to compensate for what isn't bending and flexing, which then develops adjacent segmental disease. And this is where a lot of people then go on to develop pain over time. For people who have replaced knees already, there are some limited options, but the majority of the anatomy has changed and been distorted. But certainly it's important for us to have a consultation so we can understand where your pain is coming from, even after the knee replacement. Jessica S. from 514 asked about arthritis, pain in the neck and the upper back, and stenosis in the neck and degenerative disc disease. So for us, spine therapy, it really is involved from the top of the neck, the cervical spine, all the way to the base of the tail, which is the lumbar sacral area. For us, MRI is important. We want to understand where your pains are coming from. It is, for us, part of our process, and I'm very proud to report that we're the only regenerative medicine practice that owns their own MRI, because really understanding where your pain is coming from is that important to us. And of course, we always want to know whether you have nerve-related symptoms, and any other symptoms that go along with the stenosis and degenerative disc. Joan M. asked from area code 518, simply back pain problems. So back pain is a symptom, and certainly for you, Joan, we want to understand your diagnosis. And sometimes it's as simple as a conversation and a physical exam during our consultation. But obviously, if we have any questions beyond that, for us, we'll go on to obtain the MRI, get advanced imaging so that we can really nail down that diagnosis before we start talking about things like stem cells. So for us, yes, back pain, all sorts of back pain, we help, but we always like to make that diagnosis first. If you have an MRI, great. If you don't have an MRI, no problem. We still encourage that consultation first so we can understand much about you and, for example, your goals and your activity level, your functional status. So make the consultation anyways. Rita H. asked from area code 518, treatment for spinal stenosis, degenerative disc, osteoarthritis of the lumbosacral spine. Again, this is a great example of explanation about how stenosis, degenerative disc, and osteoarthritis are all linked. If you think about stenosis really as a tunnel and the nerve is the train passing through the tunnel. If the disc is what holds the tunnel open, a degenerative disc means that the tunnel is then collapsing onto the train or the nerve. And for us, being able to treat the degenerative disc and the ligaments and tendons around it really help to keep that tunnel open. And then that means a train can pass through or your nerve can function normally. Scott R. asked from area code 315, MRI was done indicating I have spinal stenosis in the lumbar region, received 2 nerve block injections with little relief. I'd be interested in learning how regenerative medicine may help. So again, for us, the stenosis is really about improving the ability of the nerve or the train to pass through, and that really means helping keep the disc quality at its maximum. And our therapies, again, last anywhere from 6 to 10 years, but somebody with spinal stenosis undergoing nerve blocks with little relief, this is where we excel. This is where we see a lot of people who have just sort of failed traditional therapies. Cynthia E. From area code 518 says osteoarthritis, cervical and lumbar stenosis. Again, stenosis like a tunnel, the nerve being the train, the nerve being the train passing through the tunnel and really working on keeping that degenerative disc and tunnel open. Joseph B. asked from area code 518, stem cell treatment for ankle pain. So osteoarthritis is one of the most common diagnoses in the ankle that we treat. This is obviously in favor of doing an ankle replacement, which unfortunately isn't as well developed as knee and hip replacements are. Our results have shown 5 to 10 years, depending on a few simple factors. But it's also important for us to always start with that diagnosis. So you say ankle pain, but we want to understand why you're having ankle pain in order to provide the best regenerative medicine option for you. Danny R. asked from 438. I had 2 hernias a few years ago at L5-S1 and L4, 2 years ago, 10 millimeters, then the other a bit larger. I also have arthrosis in the area. Is there any treatment to be back to okay? It's been 8 years and I'm semi-functional, but only due to biweekly chiro appointments and workouts, plus not driving a bike or sitting long, etc. So talked again about hernia and jelly donuts. And you can see in this example how close that disc in blue is to the nerves, which are all in yellow. So once you develop a herniation, we're talking about very quickly it impinging on your spinal cord or very quickly impinging on your nerves. And there's a close relation of that disc to those nerves. And we've been able to help people with decades of pain, 10 millimeters or not. It's not an issue for us. It's really about going to the center of the problem, which is the disc in this case, and being able to restore that. So 2 hernias are not an issue, arthritis. And it really sounds like you've tried a lot of non-invasive therapies, and then are now ready for the next step. Don B from area code 609 said, any downside? Does everyone find some relief? So because this is minimally invasive, there's minimal risk. And so overall, very few downsides. But in terms of finding relief, there are 3 things that really contribute to success. And it's these 3 things here. It's number 1, did your doctor make a quality diagnosis? Number 2, is your doctor utilizing quality processing for your stem cells? And as a patient, it's hard to know whether that's true or not, and whether that is true or not of your physician. And I will tell you that experience matters here. Simply starting regenerative medicine on your webpage is not enough. Number 3, it's about precision. So regardless of how well the diagnosis is made and how good the processing of materials is made, if you are not placing the materials into the right area, the therapy is not going to succeed. So this is really, again, about experience and expertise. Can they make a good diagnosis? Can they process the cells well? And can they be precise about their placement of materials? Lester from 315 said, more information on treatment for severe spinal stenosis. So again, we talked about stenosis, close relationships of the disc to the nerves. For us, it's a 3-visit process, especially for somebody with severe spinal stenosis. Severity does and does not matter. So while it does matter from the standpoint of we want to understand at what levels and how many levels, it does not matter in the sense that it does not limit us from our therapies. So we've had people with incredibly severe stenosis do very well despite having these MRI type diagnoses. So severity does and does not matter ultimately. Robert S. from area code 941 says, how to eliminate hip pain without surgery in a senior citizen. So hip arthritis for us is a very common area for therapy, something we treat pretty frequently. For us, we are the non-surgical solution, so we are looking at avoiding hip replacement. Age is less a factor for us overall. We've had patients as old as 94 and do well. So not much of a concern with regards to your senior citizen status. For us, what's more important is activity level. How active are you, or how active do you want to be? For those who want to be active, we've found that they tend to always do the best, and which makes sense because they're developing strength, they're developing stability, they're developing mobility. And I often say I can inject for pain, but I can't inject for strength. That's really something that the patient has to go on to develop. Diane B from area code 518 has how this medical practice could ease my knee and leg pain. So again, pain needs a diagnosis. Is this arthritis, meniscus tear, etc.? If it is one of these types of diagnoses that's contributing to your knee and leg pain, these are all degenerative conditions that respond quite well to stem cell therapy. Of course, again, we talked about severity and how it matters versus functional status. Sandy J from 315 asks, issues related to treating lumbar stenosis and possible beginnings of cervical disc degeneration. So stenosis, whether it's lumbar or cervical, is a pretty common area for our therapies. So being able to treat somebody's neck, being able to treat somebody's low back are pretty frequent things for us. Cervical disc is absolutely treatable. It's for us really no different whether it's neck or low back. Again, therapies that last years and importantly repeatable. Betty A from area code 514 has been asking, I've been diagnosed with cauda equina in April 2024. I had emergency surgery, laminectomy, discectomy on April 13th at Sacré-Cœur Hospital in Montreal. I'm left with urinary and fecal incontinence. I'm doing perineal physio twice a week, but don't see much improvement. I was wondering if regenerative therapy would be a good option to try to speed up the healing process. So first off, Betty, we're sorry to hear that you're going through this, and it's unfortunate. But to explain a little bit about what cauda equina is, it's basically where a condition in the spine is leading to a trapped spinal cord. And it sounds like in your case, it is a disc that is causing that entrapment of the spinal cord. So what I want to know for you specifically is for your urinary and fecal incontinence, were these symptoms that were present before or only after the surgeries? So this is an important part. I want to know whether inflammation is a significant portion of contributing to some of these incontinence type symptoms. So there's a lot that I want to learn about you, obviously about your imaging, a lot about your surgery. I'd love to see you in consultation in order to get a much better idea to see where exactly we can help. I understand too that your surgery is pretty fresh, so we would, certainly be in contact with your surgeon as to, the plausibility of doing some of these therapies. Marianne K from area code 315 says, I have back issues I have issues with my lower back, particularly with L4 and L5 and S1 nerve distribution, likely related to the small left disc herniation on my MRI, bad sciatica, then sprained the left ankle and issues with my hamstring and calves, very weak and have great difficulty walking up hills. Started 11 months ago in August of 23, looking for a second opinion. Again, we talked about the donut and how that really impacts those nerves. But what the sciatic nerve is a combination of nerves. So you can sort of see in the top right picture there where the four red nerves come together and develop one big nerve. That's what the sciatic nerve is. And so you can imagine if you have a disc pinching higher up in just one of those branches, it can affect the whole nerve coming down. It's like a small river combining into a large river. If you pinch off the small river, then the large river is, of course, affected. It sounds like you are developing a combination of problems, and this is especially true when one problem affects other areas. So your low back is now affecting your ankle, your hamstring, your calves. For this scenario, we always like to focus on the spine first and then work our way out. This helps you develop core strength. And when you can develop core strength, you can certainly treat a lot more problems more effective. Robert P. from area code 518 says, recent MRI, a month old, shows I have stenosis on the slip disc. Is it possible to get relief without surgery? Also, are these procedures covered by any insurance? So this is important when you talk about a slip disc. We're talking about when the bones line up one on top of another. You can see the thing there circled called cartilage end plate, and that's what the disc sits on top of. So when your disc actually gets nutrition, it actually goes through that bone, through the cartilage end plate, into the disc. There isn't sort of an artery reaching the disc in order to provide the nutrition. So when you, quote unquote, slip a disc, you're really disrupting that nutrition source. And so this is why inflammation occurs. And this is why healing of a disc is so difficult and so challenging. To answer your other question, commercial insurance does not cover any regenerative medicine therapies. Christine B. from 315 said, chronic low back, sciatica, herniated disc, bulging disc. So for those of you who are watching, this is a pretty common scenario. This is a pretty common combination of people describing things. All of these problems oftentimes travel together. But certainly the sensation and the muscles that we have in our legs and our gluteal muscles are all controlled by nerves. And these nerves, of course, arise from the spine. The nerves essentially are wires that go from that spine to the muscle. For us, it's important to understand where is that nerve effective. But Christine basically told us where she has herniated discs, she has bulging discs. So even though you have low back pain and you have sciatica, it isn't a problem further down in the river for you. It's very high in the river here. We want to know always whether this damage that you've had to the sciatic nerve is temporary or permanent. It's always an important fact for us. Fran from 518 says, is stem cell age specific? Is your consultation free and how many sessions is needed? So stem cells are not age specific. Our oldest patient thus far has been 94, did well, continued on, active lifestyle, etc. Our consultation is free for those who are watching this webinar. So the answer to you is yes. The number of sessions, I guess I'm not really sure what you're asking. Is this something that has to be done every week, every month? The way we really look at it is that this is a single course of therapy where you do 3 injections. And once you're through that, we're looking at something that lasts several years. So therefore, it is not something with multiple and repetitive sessions. Okay, so for those who have attended today's webinar, I want to offer you a free consultation to help get the conversation started. The catch here is that you have to call this Friday by noon, and you have to mention that you watched the webinars, and you've got to schedule this consultation as well. It's okay if you have somebody who wants to watch with you and wants to watch the next webinar. The next one we'll be holding is on the 21st of August. Our phone numbers are listed here, 518-871-9900, and for our northern patients, 514-697-8919. You can also figure out your own consultation by time by going to richardkimmedicine.com and scheduling on your own. You can go to /webinars to see prior webinars and then, of course, future. If you're interested in getting an MRI on your own, you can just hit /MRI, schedule your own MRI, and we can certainly start to answer some questions from there. Okay, so that's the end of the webinar portion. I will hang out for anybody who does have a question not answered here. If you hit the Q&A button that is on your screen, it'll allow you to ask a question. So I'll hang out for a minute here for people who want to ask any questions, and I'll certainly do that in real time. Otherwise, I wish you all a very good end of the week and weekend. Okay, so it looks like all our questions are done and set. If anybody has any questions, feel free to call and drop us a line. And otherwise, we'll see you next time.